Hi, I'm Jeff Henderson with Fleet Feet, Marathoners in Training. We're here with our Ask the Expert series. I've got Dr. Darrin Bright with Ohio Health and his Max Sports Endurance Academy. Thanks for helping us out today.
Absolutely.
We are going to go through a whole lot of questions. We know a lot of folks are getting out and training for marathons, half marathons for the first time. And there's a lot of questions that people have when they first start with a program. And I know one of them is are full marathons and half marathons still one of the more popular avenues for people to get out and active in the United States?
Absolutely. When we look at the numbers, running is still one of the most popular sports in this country. Upwards of 50 million people run or consider themselves a runner and use that as their form of exercise. So still one of the most popular forms. Marathon and half marathons participation numbers were increasing significantly for several years there, but we did see a slight retraction in the last few years, but still almost 2 million I think finishers in the half marathon, about 500,000 finishers in the marathon each year. So we still have a lot of people participating in these events.
Excellent. A lot of folks will have a physician who might recommend a workout regimen, lose weight, increase some of their statistics, and folks will join groups like Marathoners in Training, setting a goal race to help with that. Are there any other benefits that they might see out of training for a half or a full marathon?
Absolutely. I mean, they're the medical benefits. So a lot of people, as you mentioned, are pursuing exercise, whether it's running, biking, swimming, some form of exercise to help lower their risk for heart disease. So we see a significant reduction in cardiovascular risk. That's largely the reason I started running myself, is my father had a heart attack at the age of 68. His father had a heart attack at the age of 68. I'm trying to fight that off. So that's the reason why I started running myself. But we also know you can lose weight through exercise. So a lot of people through MIT have lost upwards of 100 pounds by participating in the training programs. We know mental health wise there's some tremendous benefits. A lot of people treat their anxiety, depression through exercise. So there are a lot of benefits that can come through exercise.
Excellent, thank you. A lot of folks will train for a marathon and they may run into a bump or bruise, ache, pain. They get injured in some way, shape, or form. If I want to avoid being one of those people, what are some of the injury risk factors that I should try to avoid?
Sure. Well, I think one of the first things is joining a group like this. You've already made the first step. You're watching videos like this, trying to do everything you can to help lower your risk. Sure. And so I think that's the first step. That's one of the reasons I love MIT, been a part of MIT for so long, is that people who are organizing it, and developing these schedules are doing it in a way that are trying to prevent people's risk for injury and being very methodical in how we increase that mileage and get people ready for these events, and make sure we have all those resources available to everybody, whether it's stretching and injury prevention talks and programs like this. So I think that's a very important part. But when we look at injuries, there are really three big risk factors we found in the literature. One of those is the mileage per week. Once you get above 35 miles per week, we know that people's injury rates can increase significantly. And I think there's a reason why a lot of our training programs kind of tap out at the marathon around 35 miles per week, trying to lower that risk. We don't want new people just jumping in without gradually increasing their mileage. And so the program builds people up gradually to those threshold miles or threshold workouts. And then intensity, I think, is probably one of the biggest things I see. A lot of people just train hard all the time. And there needs to be that balance where you have those recovery days built into the schedule. And that's the reason why at the top of the schedule you'll see those different color-coded workouts. They'll talk about how we run those workouts, because we have to embrace recovery. If you're running hard all the time, you're never getting really the benefits of the workout and just putting yourself at risk for injury. So make sure we have recovery days where there's a very easy workout, or just taking a day off completely. That's okay to do. And then the other thing that I think about is the intensity. We think about the mileage per week. And those are really some of the biggest things that I think about for injury prevention. And then also making sure you're properly fitted for running shoes. Every time your foot strikes the ground, 4 to 5 times your body weight has to be absorbed by the body. Your shoes are your first line of defense for that. So making sure when someone's looked at your feet, made sure you're in the right type of shoe, And we're changing them out regularly. We know that after about 350 miles, somewhere in there, we lose 40% of your shoe's ability to absorb those forces. And if your shoes aren't doing it, then it's your shins, it's your knees, it's your hips. And so make sure we're changing them out regularly.
Excellent. You mentioned stretching in the middle of that. You could read any number of articles and read a different story every day. Do you recommend a dynamic warm-up or some form of stretching before and or after working out?
Yes. No. I guess the jury is still out on stretching, despite doing so many studies. Is one type of stretch better than the other type of stretch? And the literature really isn't there. Is the timing of stretch important? Do you do it before a workout? Do you do it after the workout? Do you do it in the evening before you go to bed? And the literature just isn't there. So I think what it comes down to is there's stretchers in the world and there are non-stretchers in this world. And there's some people that do well when they stretch, and there are other people that maybe don't need to stretch. Having said that, I do think there's a time when stretching is appropriate. And that's if we have some muscle imbalances where one side is tighter than the other side, we need to address those imbalances. If we have some injuries that have always given us an issue, if it's always that right calf that seems to act up, we probably need to focus on a stretching regimen. And when we're recovering from an injury, it's important that we do that. My usual advice on stretching is don't bounce when you're doing it. It should be kind of a more sustained stretch that we hold for 15 to 30 seconds. I usually say don't stretch a cold muscle, so let's get it loose, whether that's through a 4 or 5 minute jog, getting on an exercise bike beforehand, parking your car away from the trail, then walking up to the trail, then doing your stretching. So I usually advise not stretching a cold muscle. And those are my big recommendations.
Makes sense. There's also stories that you might read out there of people who run every day, having streaks for months, years, decades, without taking a day off. Is this something that you would advise?
I think if that's somebody wants to do, they can probably do it in a way that's safe. And I think, again, it's that balance of recovery, making sure if we are running every day, that doesn't necessarily mean running 10, 15 miles every day. Some of those workouts might only be a mile. And some of these long streaks that people have. And if it's just a real easy jog, that's probably just as effective as a day off. But we got to make sure if you're doing those types of streaks that there's that balance of harder workouts and very easy workouts. I think sometimes people are surprised when I talk about my workouts in a week. I'll have a variation of 4 minutes a mile. So my hard workouts will be at one pace, and then my easier workouts are 4 minutes a mile slower. And so I think, that's the type of recovery that we're talking about if we are going to do these types of streaks and have easy recovery days.
Perfect. This time of year tends to be a little bit on the warmer side, humid, what have you. I've seen people wearing these compression socks and sleeves. Will that make me too warm? Is there any positive or benefit wearing them different times of the year?
Sure. Yeah, so, there is some literature out there that compression socks can help to improve performance and help enhance recovery. So they do have some science behind them. I do worry about these really hot days, though, when we do have compression. If a compression sock comes all the way up to your knees, we have pants on or even compression shorts underneath those pants, it ends up we're almost in tights, and that will increase our risk for heat illness and our body's ability to get rid of heat. So usually in those really hot days, I recommend avoiding compression. Don't be shy. Make sure you're wearing shorts and short sleeve shirts so that you can help your body get rid of that heat during the workouts. Avoiding the hotter times of day, so getting up early, before it gets, to see the whole heat of the day. Try to get those workouts in early or later in the evening. Hitting the cooler times of day is going to be important. And then there's a time when maybe we should find a treadmill, on those really hot days. And then you can control the heat that way. So I think there's some things that we can do to help prevent heat illness, and some of it comes in the clothes that we wear and the time of the day that we exercise.
Sure. Finished up a run this past Saturday with our group, and we actually got this question from a member in the group who overheard somebody talking about losing toenails. Is that something I should be concerned with if I'm a new person to the marathon and half marathon training program?
I wouldn't say be concerned with, but know that it will probably happen.
Sure.
That's not a matter of if, it's a matter of when. There are some things you can do to lower your risk, though. Keeping your toenails cut short is very important. There are different theories as to why people lose toenails. Is it the toenail banging the front of the shoe? Is it the tension as your foot hits and it's kind of generating that tension underneath the nail bed? or is it the shoe rubbing on the top of the foot? Either way, I find that sometimes a shoe that's a little bit larger, so going up a half size or even a size can sometimes help, and that's something I kind of defer to the shoe fit experts at Fleet Feet and Front Runner. Having them kind of get you in the right type of shoe is definitely important. If you do get a black toenail, that usually occurs from bleeding, where the blood kind of accumulates underneath the nail bed. Sometimes you can have that drained, and it's not very painful. It sounds very cruel, but it will help to relieve that pain pretty quickly. But proper shoe fit really going to be the key for that.
Perfect, thank you. Chafing and body glide.
Yeah. So chafing is an uncomfortable thing for people who've had that before. You can get chafed in a lot of different areas. Men tend to get a little bit more in the chest. And so there's some Band-Aids that you can use. I know the store sells the nip guards that are more specially designed Band-Aids that protect those sensitive areas in the chest. And then there's also Body Glide, which is kind of almost like a roll-on deodorant you can put in other areas where sometimes people may be getting some chafing, whether it's in the armpits or in the groin. But chafing does occur quite a bit, and there are some things you can do to help prevent it. And then also probably the clothing that you wear. You know, we have a saying, cotton is rotten. So if you can wear some more synthetic fibers to push that moisture away from your skin, that's going to probably lower your risk as well.
Oftentimes somebody may have an ache or a pain after a workout, whether it's with MIT or they're out on their own with a workout. And too many of us may be guilty of trying to self-medicate or hope the pain's going to go away. What's your recommendation around if something just doesn't feel right on a run?
Yeah, so, you know, there are those normal aches and pains that occur part of training. What I always say is I worry about pain that's persisting, pain that's in a joint, pain that's affecting your gait, so you're limping, you're altering your body mechanics. That's the pain that I normally say we need to address. It's not uncommon, though, to get some random aches and pains. If it's not affecting your gait, it's tolerable, it's probably okay to continue the workout. But at the same time, you know, we have those kind of built into the schedule that, you know, if it's just not your day, it's okay to abandon the workout. You know, there have been days, actually my wife laughed the other day, I got a 0.03 mile run in. Because I started out, I got to my mailbox and I said, you know, it just doesn't feel right today. So I took the day off. That's okay to do once in a while.
Perfect. If your ankle hurts or your knee hurts or you've got something that doesn't seem to go away after the workout, should I ice it? Should I put heat on it?
Yeah, so I'm always a fan of ice.
Yeah.
Ice is anti-inflammatory, helps to reduce swelling. Heat is a vasodilator, so it actually increases the size of the blood vessels, which therefore increases blood flow to the area and will increase swelling. So I normally don't recommend heat acutely. I'm more of an ice fan. And then if you do have one of those aches and pains after a workout and you're maybe at one of the MIT workouts, there is an Ohio Health Athletic trainer that's at every event, so you could always curbside them and say, hey, you know, this is what happened in today's workout, and they can give you some advice on other things that you could do to help start that treatment program. I know with Fit for Life at Front Runner and Fleet Feet, they also have some therapists that will do injury assessments. And then in all of our emails that go out through MIT, there's that link. If you have an injury, click on it. That comes straight into Sean and myself, and then we can kind of review that and try to get people in contact with the right resources.
Excellent. Some folks will run maybe their first half marathon, particularly like spring, winter time, as they're going through their training. They don't drink any water during that race, but maybe I'm going to train for a full marathon. What should I start to think about as far as how I hydrate, how I'm taking care of myself throughout the day, not only on the run, but maybe throughout just the normal day?
Yeah, hydration is really important. We know that if you are dehydrated, it can decrease your risk, or it can decrease your performance. We know that a dehydrated muscle is more prone to injury. And also, if we are dehydrated on some of these hot days like we talked about earlier, it can put you at increased risk for heat illness. So hydration is very important. We know the average person just walking around, we've done studies, you know, not training, not out when working out, just the average person is walking around 2% dehydrated at any one time. So it is important that we hydrate and stay well hydrated going into those workouts. So hydration doesn't begin at the workout, it really begins throughout the day and the days before the workout. And then that's part of training, is that we get our body used to what we need to do in order to achieve top performance. And so when we are working out and doing our workouts, it's important that we practice drinking. Some people aren't used to that, and so we want to make sure when we hit those water stops, you take in some of the Gatorade, you take in some of the water, and just get your body used to incorporating those fluids into your body while you're working out.
Excellent. Well, in addition to your responsibilities here at Ohio Health and as the Max Sports Endurance Academy, you also develop and put on the Runners Clinic. You're the medical director of the Columbus Marathon. What other questions, what other things are first-time marathoners, half marathoners running into, as we wrap up this session that you might want to point out?
Yeah. Well, one thing I would just say, really for all runners and everybody exercising when we're outside, is make sure you're visible. Unfortunately, we see every year where runners and people, pedestrians, get hit by cars, and we oftentimes are seeking out those earlier times in the morning when it is dark. We can see everybody because our eyes have adjusted, but people in cars don't see us as well. And so make sure you have one of those big flashing red lights on. I know you guys have a lot of illumination products in the store that make sure that we're well seen when we're out on the road. So be safe while you're out there.
Yep.
And I think the other thing is just know you can do it. It's just one step at a time. Sometimes it's kind of intimidating thinking about 13 miles or 26 miles when we're in some of these earlier workouts. But stick with the schedule, have faith in the schedule, have faith in of all those people around you. They're going to guide you there, and you're going to get there.
Awesome. Thank you so much, Darrin.
Yeah, appreciate it.
Continue to tune in to our Ask the Experts series. We'll be doing this all summer and fall, so we'll have a variety of folks speaking to a variety of topics. So tune in, and as Darrin said, you can do this. Keep at it. Change your life 1 mile at a time. Thank you very much, Darrin.
Thanks, Jeff.